I'll call to order the Brawley City Council and successor agency to the Brawley Community Redevelopment Agency regular meeting of January the 18th, 2022 at 6 p.m. The call to order, the roll call, please.
Councilmember Hamby,
Here.
Councilmember Wharton, Councilmember Castro.
Here.
Mayor Couchman,
Here.
Councilmember Nava.
He just joined,
Okay. Okay, so we're all present.
so we're all
Yeah.
present. Okay. Invocation, I'll have Luke, if you would. All right, grace us with that.
Everyone that's here, let's pray. Almighty God and gracious Heavenly Father, we are grateful to you tonight for this opportunity to gather together and to commit ourselves to leading our city the best way that we can. We ask that you would give us the wisdom that we need to make the right decisions for the future of our town. We ask that you would continue to keep us safe, that you would watch over our city, that you would take care of our law enforcement and firefighters, that you would protect them, Lord, that you would drive out this pandemic of COVID-19, and that you would reduce through a spirit of community crime that happens here. We thank you that this is a wonderful place to live. We thank you for the sense of community that we have here. We thank you for the way people come together in difficult times in the city of Brawley. And we ask that you would just help perpetuate that you would watch over us tonight and into the future. In Jesus' name, amen.
Amen.
Okay, and Pledge of Allegiance by Bill, please.
Ready to begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, everyone. Okay, we'll look at item 1, which is approval of the agenda, and I would entertain a motion.
I'll move to approve the agenda as
I have
well.
a motion, and do I have a second?
Gotta demute the council members.
Do I have a second for approval of the agenda? There,
Donnie.
okay. I have a second, okay. So all those in favor of approving the agenda, say aye. Aye.
Aye.
Those opposed? Okay. Okay, item number 2, public appearances. Do we have any public appearances tonight?
I don't see anybody.
None?
No.
Okay. Okay. Presentation, item 2D, presentation on the Imperial County Behavioral Mental Health Mobile Unit by Leticia Plancarte Garcia, ICBHS Director. There she is.
Good afternoon.
Okay.
My name is Leticia Plancarte Garcia, Director of Behavioral Health, and Maria Ruiz is here with me, and we will both be presenting on the crisis management.
Okay.
If you could allow her to speak and also to...
Maria Garcia Armando.
Reese.
Reese.
There she goes.
There she is.
Are you able to see the presentation?
Yes.
Okay. Well, thank you for the invitation. Like I mentioned, my name is Leticia Plancarte Garcia, and Maria Ruiz is Deputy Director of our triage unit. We will be presenting on our crisis management. So I will be giving you a little bit of history. This is what we'll be presenting on today. The RDA, the report that was presented to the county on recommendation, data considered for implementation, and also another consultant that was hired to assess and give us recommendations for our crisis management. Just a little bit of background. There were several concerns related to our handling of individuals who experience psychiatric emergencies. Some of the concerns were that we did not have adequate locations to drop off our clients, individuals when they're experiencing a crisis, limited psychiatric hospital beds, and also that in many cases, individuals do not accept treatment, that treatment is voluntary, and that many times the community gets frustrated because they make referrals and services cannot be forced on an individual. So the local health authority hired the resource development associates to do an evaluation. They contacted the different agencies and stakeholders. They conducted interviews. They had community meetings just to collect information on the current system, and then they provided recommendations based on what they found. So this is in a summary, the recommendations made by the RDA, the consultants. So they divided the crisis continuum of care in different phases. One is a crisis response, the other one is the crisis intervention phase, and then the crisis resolution. So when an individual comes to the attention because they're having a crisis, when we're dealing with that individual during the crisis, and then what happens after we have resolved the crisis. And then there were across the process other recommendations for all agencies to work together. And so the reason I'm presenting, this is how they presented the recommendations, and this is how we're gonna be talking to you and explaining what has been done in the different phases. So Maria will start with presenting on the crisis response phase, which is the first phase when we come in contact with individuals, or before, what can be done before we face a crisis.
Good evening, Maria Ruiz. And as Letty mentioned, I mean, it was divided in different phases. I mean, and the actions that we were taking is ICDHS continues to provide education and dissemination of information. I know we all have difficulties because of the COVID, and because of that, the in-person training needed to be suspended for the year 2020. However, we start reaching out to the community and doing some Zoom meetings to continue the education. And little by little, we've been resuming in-person and virtual trainings available. So that was part of the steps that ICDHS has been taking. Another thing that it was part of the implementation of the crisis for response team. So within that also, the training, that was an in-person training that was provided to law enforcement. There was still training available during that year. And the training is for this is the Applied Suicidal Intervention Training. So, but unfortunately, because of the same situation, only 5 officers within Imperial County were able to attend. But I mean, it's ongoing training with law enforcement in regards to mental health services. ICDHS and the law enforcement agencies met and implemented the crisis for response team. We decided to start a pilot team in November 4, 2020. And I will be discussing more in detail about what is the crisis for response team. Another of the recommendations was the transportation. There was an issue with transportation, so ICDHS met with AMR and discussed the needs of behavioral health clients to be transported to hospitals when needed. So that was the crisis response phase, the actions that were taken before. Without saying also, just to give you a little bit of information, one of the goals in developing the crisis for response team, it was just a coordination between ICDHS and law enforcement. We met together and we wanted to be having a collaborative approach and to manage individuals experiencing psychiatric emergencies. And the goals were definitely the reduction of involuntary 5150 calls. We wanted to intervene beforehand so we can assist those individuals and prevent 5150s. The other one is reduce the time that law enforcement was spending in psychiatric emergencies. And the other goal as well is to reduce the numbers of clients that were sent to the hospital for medical clearance. Those were the main goals for the CCRT. So as I mentioned before, we started a pilot program in November 4 of 2020. First of all, we start in the South End area, and within a month, we expand our services to the entire Imperial County. The pilot, based on our meetings with law enforcement, it was decided, and based on the data collection, it was decided that we're gonna do 4 days, 10 hours per day, from Wednesday to Saturday, from 12 p.m. to 10 p.m. Because that's where the data was showing that that's when they have more crisis emergency calls, and that's how we started it. So we developed a protocol that was put together with law enforcement, and how are we gonna be operating, what will be the criteria to responding for those calls, and that was very helpful. And then we continue having monthly meetings with the law enforcement agencies to discuss any barriers, any difficulties, and problem solve any issues. So this is just some data of what was during the time, the crisis for response pilot team, it lasted for 6 months. It was through November 2020 to June 2021. And if you notice, I just wanted to mention, out of the 99 calls, at the beginning it was a little bit difficult because of the pandemic. There was many factors, but we received a total of 99 calls. And out of those 99 calls, only 11 individuals were placed on a 5150. So 88 of the other individuals were handled by ICDHS. So once we arrived to the scene, we provided interventions. The law enforcement was released, and we took over and we assist those individuals in any other needs that they might have. The trends of calls during the pilot program, if you notice, one of the days that it was the busiest day, it was on Wednesdays, and it was from 12 p.m. pretty much to 8 p.m. So following up by Thursdays, Fridays, and then Saturdays. So all those 4 days were busy, but the busiest day was Wednesday. Out of those 20, we received 20 calls outside the schedule because we were also wanting to capture any calls that was the schedule that was set, but we wanted to know if we needed to expand the services, what hours do we need to operate. So we only received 20 calls outside the schedule, and we were able to seize 12 of those calls. And those 12 of those calls were during regular working hours as well.
Can I just add something, because I don't know that we mentioned, that the whole idea of the crisis for response team is that law enforcement receives the call, and when an individual is identified as having a mental health crisis, then the protocol calls for law enforcement to notify us, and we meet with law enforcement on site. So that's our co-response. We get notified. Law enforcement makes a call when they feel we need to respond with them.
So as we mentioned, 59% of those calls that we received for the crisis for response team, it was from El Centro. We have only 3% from Brawley, 77% from Calexico, and and then following up by Imperial County Sheriff Department, it was 28% of the calls that were received. So I just wanted to mention that by the time we received the call to our crisis center or to our triage unit, it took us like about an average of 23 minutes to respond to the client's rotation. And then it took us like 26 minutes to relieve an officer from the scene.
And the last numbers in red, what you will see is the number of calls that were made and the number of 5150s that were placed by those specific law enforcement agencies. So for For all Central, to give an example, there were 58 calls, and of those 58, only 4 clients required to be placed on a 5150, and those are the 4 that law enforcement had to transport.
So, so, based on the CCRT schedule implemented in the project, it was an agreement that we met to discuss, we collect the data from all those months that we were, having the pilot program, and it was agreed that we will be expand our services, not only in hours, but on days. So it was agreed that we're gonna be responding 7 days a week from 8 a.m. to 10 p.m. And that was based on the calls that we received during the pilot program. So the protocol was updated as well. So for now, I just give you some information from July 2021. That's when we finally decided not to continue as a pilot. It's gonna be a standalone program. And that was July through December. We have been receiving 146 calls. And if you notice, only 15 individuals got placed in a 5150, which is 10% of the calls only. I wanted to let you guys know that 82 of those individuals did not meet the criteria of 5150, which is 56%. And then the CCRT team was able to de-escalate 34% of those individuals from a 5150. So we were no longer needed to be placed in a 5150. So out of those 146, 131 were handled by ICBHS, which is 90% of the calls. In the current call trends, for the most part, we noticed that it's still from 8 a.m. to 8 p.m. And then the busiest days is Monday, which is actually Wednesday, it continues to be the busiest day with 90% of the calls, following up with very similar with Monday, Tuesdays, Thursday, and Friday. And then we will continue keeping track of the calls from outside the scheduled time, which is from 10 p.m. to 8 a.m. in the morning. And we received 9 calls. And out of those 9 calls, 5 calls outside the schedule. But then also we continue receiving calls from law enforcement. And 9 of those calls, as we were responding, they got canceled. Canceled for different reasons. They probably felt that the person needed to be placed on a 5150 and they no longer needed the ICBHS assistance. What I mentioned as well, the average time to respond to the calls is 25 minutes and then 30 minutes to relieve the officer. I would like to mention that if those 30 minutes is the time when after we assess, we provide interventions and the staff feels that they can handle it. So 30 minutes is enough to the officer to decide to leave the scene, and some of the officers would like to stay longer just for safety precautions as well. So again, El Centro, like we mentioned, 35% of the calls came from El Centro City, 6% from Brawley, 14% from Calexico, which was an increase on calls. If you notice before the pilot, the cities are participating more in contacting the CCRT more frequently. Imperial even also increased 10%. We also have Westmoreland with 3% and ICSO with 31%. Also Brawley increased to 6%. And as we mentioned, only 15 individuals got placed on a 5150. And what we mentioned before, out of those 51 from El Centro, only 5 got placed on a 5150.
So now we're moving to the intervention phase. Some of the things that were recommended by the RDA is that we consider implementing a crisis stabilization unit or a crisis psychiatric health facility. And with the implementation of those facilities, they recommended that we transition our current triage unit into an outpatient facility. So because we understand what it takes to run those facilities and how difficult it has been for other counties to operate it, we decided to hire a consultant who came and did similar to what RDA did. They looked at our number of 5150s, the length of stay, hospitalizations, and I will go into more detail on their findings. So we have not transformed our facility. They also recommend, the RDA recommended that a big problem was individuals that were from the county jail and that were being brought to the emergency room when they had a crisis. And the hospitals were concerned that this was not the most appropriate place for individuals from county jail. And since then, the county jail has contracted with San Diego for a psychiatric bed for their inmates. Before COVID, we had been providing individuals to the hospitals to assist with assessment, 5150 evaluation, and coordination of care. When COVID hit, we were asked to remove our staff because of safety concerns, and everyone was concerned about COVID. When things slowed down recently in July, they asked that we reinstate that position. So we have trained 2 individuals to assist with the El Centro Regional Center, and then also for Brawley, but Brawley has not really given us a start date. And there were some questions regarding the transportation and medical clearances. One of the biggest concerns that we faced during COVID was the need to have individuals tested for COVID. What happened is that we started requesting that 100% of admissions be screened for COVID, because one person could really eliminate most of our facility. And that was the case at the beginning. People were being exposed and we were being asked to not bring them to work. So because our workforce reduced, so did the number of admissions. And I'll give you an update of what happened and how we have been changing that. So as I mentioned first, I'll cover the 2 facilities that were recommended for us to implement it in Peon County, and one was the Crisis Stabilization Unit. So a Crisis Stabilization Unit is a 23-hour facility. So after 23 hours, you're expected that this individual would have been released and placed at a lower level of care or a higher level of care. So the level of staffing required for this facility is very high, 24-hour, 24/7 doctor, nursing time, and licensed clinicians. The average cost of running it is $3 million a year. And when we looked at other counties, of the 30 frontier and small counties, only 3 operate a CSU, and 1 has closed recently because of the cost. So when the RDA initially did their recommendation for this facility, they looked at very large counties like Riverside, Los Angeles, for us to look at how they're implementing. So we had concerns about the comparison of Imperial County to those big counties. So we asked that they look at smaller counties that were more in line with Imperial County. So we hired Kemper Consulting, and they looked into Humboldt County, Napa, and Nevada, and they looked at how they implemented their CSU. Humboldt, again, they have to take 1.3 million from their realignment, which is very, very expensive, and for us, it would really take a lot of our budget. Napa County relies on other funding sources like private, community grant realignment, and county general funds. Nevada County is not an LPS designated facility. They operate a very small facility, but they only operate it during regular work hours, and the rest of the time, all clients are being seen by the emergency room. So that actually we're very interested in what we're doing in Imperial County. So of the 28 medium and large counties, only 14 counties have CSUs. And these are usually very large counties with more resources than small counties. Alvarado Parkway, which is the provider that right now runs our Jackson House, the adult crisis residential facility, had been considering being a provider and open a facility. But after they saw the cost and the number of clients that we, Imperial County, would be placing in a facility like that, they indicated that our numbers were too low to sustain it. So these are the numbers of our admissions. So we went back for 3 years, and if you notice, we put 2021 at the bottom because of COVID. The numbers decreasing significantly. So we wanted to see what our numbers have really been before COVID hit. So our numbers, our average daily is 2.84. And those are all the 5150s admitted in our triage unit per year. We average about 85 and average to 2.78. So at the bottom, you're gonna see that most of the clients get released within 24 hours. Those are the numbers for the years mentioned above. 50% of them stay with us past those 24 hours, which means that if we had a CSU and we placed an individual, we can only bill or we can only claim for 23 hours. The majority of those clients would need to stay, and we wouldn't be reimbursed for the services that we provide, which is like 50% of those clients. I don't know if you have any questions regarding the CSU. The data that I'm gonna cover next is a psychiatric health facility. So this is the other facility that they recommended, and this is a facility that the minimum admission or population is 16. So we had to build a facility with 16 beds, and this would be for those clients that we typically would hospitalize. This is a long-term facility where clients can stay up until they are ready to be released, like from a psychiatric hospital. So the 21 counties across California, only of the 58 counties, only 21 counties have psychiatric health facilities. And again, mainly in large counties, because of the staffing requirements and the cost of operating it. We also approached API to see if they were willing to do a regional facility. And they, again, because of the location of Imperial County, they were not interested. There are counties in the northern area that do have a regional hub. And the reason why it works is because they have a lot of small counties with limited resources, so they join together to develop a facility that serves multiple counties. The difference with us here is that we're surrounded by, we have San Diego on one side, San Bernardino, Riverside on another side, and they have their own resources. They would not be interested in bringing their clients here. And this is what API is experiencing with the Jackson House, our residential facility. It's a 15-bed facility. We contract for 10 beds, and they have a hard time filling the other 5 beds because they're not able to bring clients from other counties. They have even gone to Yuma, and again, they're not able to get other people interested in bringing clients to Imperial County. So that would have been the same situation with a psychiatric health facility. So here is our hospitalization rate. Of the average 1,018 individuals that that are placed on a 5150, only about 16% of those are hospitalized. In a year, we average about 166 hospitalizations. So our numbers are very low to sustain a 16-bed facility. Here you can see that the average, and I know this is a lot of numbers, and we provided you with the presentation, but it's for the different fiscal years, 17, 18, 18, 19, 19, 20, 20, 21. And it gives you the number of adults and children and youth, that's C by children and youth. And then the number of persons, unduplicated persons, the persons, all the hospitalization episodes, which means the number of hospitalizations, the number of days that we hospitalize individuals in a year, and then the average hospitalizations or hospital episodes. So on average is 8.6, and of those hospitalizations, at the top where you see the green numbers, those are the number of individuals that repeat hospitalizations. So of the 138 hospitalizations, 22 were of repeated individuals. So on average, the daily bed use in a hospital for adults is 2.2, and this was for 17-18, and 1 for child. So the total is 3.2 beds. It was a little bit higher in 18-19, it was 4.6. 19-20 was 3.4, and again 20-21 2.1 beds. So for looking at these numbers is where we understand that it would be difficult to sustain a 16-bed facility. In regards to medical clearances, as I mentioned before, before the pandemic, is there a question? Go ahead, Mr. Castro.
Yes, ma'am. Real quick, you mentioned earlier that there is certain requirements to meet that criteria for 5150. You guys didn't read on it. If you could just expand on that a little bit, and it's just because it's just for the folks at home who are wondering, like we have this growing homeless population, and we believe there are mental health issues, but I wanna, even myself, just for clarification, the difference between 5150 and your standard, all around mental health issues that are affecting our homeless population.
Sure. So a 5150 is when an individual, because of his medical condition, mental health condition, is considered a danger to self, where they want to harm themselves and they really have the intent and the ability to carry out the act. So there has to be serious enough that we really believe that individual will harm themselves. A danger to others is again because of their mental health condition. They are making threats to other individuals, and they have the means and the intent to carry that action. So that's when they're placed on an involuntary hold, their rights get removed, they're placed on a hold, so that they are not arrested, but for the most part, they are placed into the care and custody of law enforcement or behavioral health. The criteria for gravely disabled is for individuals that because of their mental health condition, they are not able to take care of their own needs, shelter, food, and self-care. So, and these are very hard many times to support, because many times individuals have others that are able to provide them meals, that are able to take care of them. So as long as it's proven that someone is assisting, many times it's hard to say, this individual meets the criteria because they're gravely disabled. So it has to be where the mental health condition is really impairing that individual to the point where they're not able to care for themselves. When we're talking about homeless, or individuals that we know are at home, and they may have a shelter, but we know that they're psychotic, they're hallucinating, but they're really not causing damage, or they're not harming anyone. They're treatment is voluntary. And I think this is one of the parts that is very hard for individuals to understand, that mental health services and substance use services are voluntary. We cannot force individuals to medicate unless they meet one of those criteria. So you may have someone that's depressed, that's crying, that it doesn't want to go to school, that they cannot go to work, but if they're not threatening to harm themselves and they don't want services, it cannot be forced on them. So yes, we see a lot of individuals that are homeless that are able to get food, that refuse mental health treatment, that may be hallucinating, maybe talking to themselves, or talking to things, or hearing things. Again, as long as they don't meet that criteria, they cannot be forced to take treatment.
Got it. Thank you. I'll mute myself again.
Okay. So one of the things that the triage unit has always had in their facility, there's a specific protocol and who gets admitted and who cannot get admitted. Individuals that are aggressive behaviors, or individuals who are in need of medical care. Our triage unit is an LPS facility, and we accept individuals to facilitate their placement in a hospital, in an inpatient facility, or to assist them with linking them to a lower level of care. We are not a medical facility, and our staff is not such that we can have those individuals in our facility. And many times, individuals are very aggressive because they're under the influence, or because of their mental health condition, they become violent. In those cases, those are the exclusion to who can be admitted into our facility. Again, a medical clearance was only required on certain individuals that there was obviously a need for having them medically cleared. But with the start of COVID, no one was accepting our clients unless they had a negative COVID results. So that's why we started asking for all of our clients to get tested before admission, and also to protect the staff and be able to continue operations. So and we understood that this was overwhelming for law enforcement and for everyone that was dealing with clients having to get a medically clear and tested. So we spoke with public health, and they agreed to test those individuals that in the past we would not have required a medical clearance. People were not doing well, were experiencing a medical condition, we would admit them. So now those individuals are being cleared through our public health, and behavioral health has applied to be to provide the antigen test. We have been approved, our staff has been trained, and we started this week doing our own testing. So this has really relieved a lot of law enforcement having to take all the individuals to the hospital for medical clearance. So historically, and this is one of the things that we went back and looked at the numbers, what was the percentage of cases that we were asking for medical clearance? Because at one point it seems like behavioral health is 100%. If you notice, the last year, which was during the pandemic, is where we did increase the request. But before that, it was only 68% of the cases that were being done, and 38% were being requested by ICDHS, and the other 68% was because the individuals were obviously in need of medical care. So those are the numbers that we're hoping will be decreasing. So the crisis resolution phase, which is after the crisis. Maria?
Yeah. So for the crisis resolutions, and that was the recommendations after the evaluation, it was definitely one of the things that it was finding is that they felt that individuals were not engaged properly, and they need services after having a crisis episode or psychiatric emergency. So the step that we've been taking is, of course, we continue providing supportive services through, we have two different programs. One is the transition engagement and supportive services, which is pretty much providing outreach and engagement services to those individuals that are getting hospitalized in an inpatient facility and are not currently receiving mental health services. So with that program, what we're doing is we are assigning a case manager that is working very closely with them and guiding them through the process, the process, and ensuring that we are assisting every single individual with needed services and referring them to services and transitioning them to the outpatient services once they complete the intake process. We also have the community engagement and supportive services, and that is mainly for those individuals that are on the community that are not coming into triage, but they're being identified as having potentially a mental health condition. The community members, so anyone who sees, they can send us their referral, and we can start working with those individuals, trying to do the outreach and engagement services. And also as part of having an individual co-located at the county jail, so that way we could have providing additional services for those individuals once they get released from the county jail. We also have locate a rehab technician at the day reporting center to do the coordinations group and individual interventions for those individuals to provide services. And as we mentioned before, we do have a mental health rehab technician that also is providing more recognition training groups at the county jail, and then also working on the discharge plan with them. So that's one of the resolutions. The other one is there is that population that is hard to engage, and they are frequently utilizers of services, either emergency room, law enforcement, or mental health services. So ICDHS is in the process of implementing assertive community training. We just completed the training. It was a 3-month training, so there is a staff identified and the staff was trained, and we're in the process of implementing the program. And also an MOU was implemented for the diversion program, which is with the public defender, so that's what we think we're gonna be receiving the majority of the referrals to provide services to those individuals. And I will discuss more in detail about this. One of the things that was recommended is to expand.
Ladies, I don't mean to be rude as the mayor, but this is running way too long for us
Okay.
on this meeting. We're at 40 minutes now, and I'm going to have to ask you guys to wrap this up. You can provide this information to us in writing, and we will go over it as individual council members. But most of this is more related, I think, to something that the city manager would be handling and the police department. And so we're all interested in mental health. I've been involved in it all, at the county level in job training programs and everything. However, for the city council, this is running way too long. So if I would like to ask you guys to wrap it up in about 5 more minutes. Thank you.
Yes, so let me just go to the end and mainly talk about 3 new programs that we're bringing on board to assist with the continuum of care. We will be implementing a program, Casa Serena, at the end of this month. And that will be services for those individuals that need the support since, the majority of them are not meeting the criteria of 5150 or de-escalated. So this information has been provided to you as far as the new programs that are coming on board, additional supports for our crisis, our mobile units. We'll be focusing on one of the mobile units for the schools, for the hospitals, and also to enhance our current CCRT. Another grant that we will be receiving to assist with case management and linking of individuals that are need, like being discharged from county jail. So In a nutshell, just to let you know, a lot of the things that we're doing as part of all the recommendations that were made to behavioral health was to really decrease the number of individuals that are placed on a 5150, to increase our mobile and community-based services. We have seen an increase of individuals that are coming directly to behavioral health, hoping to reduce the stigma associated with mental illness and increase the number of individuals that are coming and seeking services when they're not doing well, and also voluntary hospitalization. To summarize the recommendations made under the 3 different layers or 4, ICBHS has been working on addressing all of the different areas. The only 2 that you see highlighted are the functions that needed to be changed for our current unit. So Kemper Consulting did not agree with the RDA of implementing the facilities because of the reasons we just addressed earlier. And they recommend that we continue with the triage unit, enhancing the services with the other programs like we mentioned, Casa Serena, increasing mobile services, and providing more support to those high need population, including the homeless, people exiting the county jail. And we're hoping by expanding that we'll be able to decrease hospitalization and individuals being placed on an involuntary hold. So with that, I would like to know if there are any questions.
Do we have any questions from anybody online? No? Okay, if not, thank you very much for your presentation, and we'll certainly be following up with you as regards our LEA. We want them to continue to cooperate, and the city will continue to cooperate with you in all your efforts, and we certainly see the need for the mental health services out there. We have an extreme homeless population, and so we will be following up with you, and we'll direct city staff to coordinate with you for the future. Thank you.
Okay. Thank you so much.
Okay. Now we'll go to item 2E, which is our 2021 community update from Captain Perkins, Commanding Officer of NAF El Centro.
Hey, good evening, Honorable Mayor, Mayor Cotron, welcome. I want to congratulate you on your assignment. Sorry, they were switching screens and I just thought you lost me for a second.
Thank you. Thank you for the congratulations.
Yeah, and it's great to see all the members there. I know some of you are in different seats now than when I was up there last, but thank you for allowing me the time to talk tonight. I'll be brief. I also want to thank Mr. Armando for helping me with the slides, and I do see them being pushed right now.
Okay.
So as mentioned, my name is Bill Perkins. I'm the commanding officer of the air base out here for the Navy. Next slide, please. So our mission, I've got 2 major bosses, the Chief of Naval Operations, who's building the Navy to fight the future fight, and that's what he wants us to do. And then my installation admiral, who's in charge of all the Navy bases across the country, wants us to not only sustain the fleet, but enable the warfighters and support our workforce and families. To do so, our mission is to provide the best combat training we can while we're here, and my vision is to be the premier tactical training area for student pilots for this part of the country, as well as continue to be trusted partners across the community and across the valley. Next slide, please. So that's who we are and why we exist. So what did we do last year? Chief of Naval Aviation and Training, that's Sinatra. They made over 1,000 new pilots across the country in various forms, various different places, and almost 600 of them actually touched El Centro at some point during 2021. So we're key and instrumental to training the next wave, the next generation of pilots. Almost everybody you see in the air around here is a student in one platform or another, and that's really important to building the future Navy. We continue support to the entire Navy aviation enterprise, not just students, but also fleet squadrons, Marine squadrons. We did Homeland Defense, and we also supported key NATO allies and key partners that the U.S. has around the globe. The United Kingdom spent almost 9 months here with different squadrons training as they were preparing to do either NATO missions or national United Kingdom missions across the globe. Late in the year, we had our first unmanned system, which is a remotely piloted helicopter, the MQ-8 Fire Scout, did test and evaluation out here, and they're going to become a frequent performer out here. So that's another aircraft that's flying around out here that's got nobody in it. They actually control it from a ground station back here at the base when it's working the field overhead or out in the ranges doing different training missions for that system. So that's kind of a new and exciting thing, and we're looking forward to integrating manned and unmanned systems over the next few years. Late in the year, as we got our hands around COVID, we started back up what I think is a crucial part of our community engagement, which is live joint drills. So El Centro SWAT came out to the base and participated with my law enforcement and police program on base to do a active shooter drill. We also had REACH come out and do a live patient transfer from our fire program out to that helicopter. So we're prepared, and I want to get after a little bit more of that as we look into 2022, getting back to that live integrated training with our partners across the valley. In 2021, we conducted a virtual air show. We did the best we could with what we saw last year, and we're seeing what we can accomplish this year. And I'd like to come back in about a month or 6 weeks and give you an update on what we're planning to do for our Festival of Flight in 2022, if your schedule permits.
That would be fine.
So the culmination of all the great work that the men and women that work out here in 2021, it resulted in the Navy Region Southwest Small Installation Excellence Award. So we were the small base winner of that program. We're now competing at the national level, and we should find out pretty soon how we did with that. And the final thing on this slide, we celebrated our diamond anniversary. We turned 75 rather. And next slide, please. And if you know the Captain Bacon, who's a retired Navy captain, he likes to put out some cartoons about really poking at Navy life, good stuff. But this was the cartoon he made for our 75th anniversary about why pilots really come out to El Centro.
That's good.
That's a good one.
That's good.
Next slide, please. And I think Mr. Bacon has some ties to Brawley, if I remember correctly. Looking forward to our range safety and environmental stewardship. So something we accomplished last year, not only in our environmental stewardship role, protecting some endangered species and some species of concern that inhabit our bombing ranges and the base itself. We also went after range safety. We're trying to keep the public safe, and we put up a fence line out there at one of the more common areas that we get range incursions. And range incursions are a challenge, not only because it interferes with our training. The pilots have to abort, and as I mentioned, they're students, so they may be, at a very precarious time in the flight profile, 30 degrees nose down with the nose of the aircraft pointed straight at the ground, and then have to pull back and yank out and avoid if somebody's where they're not supposed to be. So it endangers our pilots. It also endangers the people that are out there, and it also endangers the flat-tailed hornbills. That is a habitat area that we have worked very closely with the environmental program to maintain compatible use. And when people come out in areas where they're not supposed to, it endangers all of that. So I just ask the public to stay off the federal areas, remain in the approved recreation areas, and have some fun when you're out there. And my team will provide more information about exactly where this is located. But as a general rule, I ask everyone to just please stay off the federal bombing ranges because it's dangerous for you and it causes significant challenges for us. Next slide, please. And looking forward to 2022 for the rest of the year here. Continue our primary mission, pilot production, making new student pilots into winged aviators and getting them out to the fleet. Working Marine Corps and Air Force integration, and I expect to see the Thunderbirds back here in a couple weeks. They have now announced that El Centro will become a permanent part of their winter training cycle. They won't be here as long as the Blue Angels, but they will come out every February for about a week to 10 days to integrate with the Blue Angels, to take advantage of the great weather and the great flying weather that the Valley provides. It's been successful the last 3 years, and we're going to see them again here pretty soon. The United Kingdom is coming back with another detachment. They'll be here in late March. And we are going to do a Festival of Flight. I'm working closely with county planners to do the right level as appropriate for COVID conditions. So I'll make a decision in early February on exactly what that's going to look like. But we are relying very closely on what the numbers look like across the county so that we can do something that's safe for us and safe for everybody who comes to observe. We're going to continue joint drills that I mentioned earlier and live integrated drills with law enforcement and firefighters across the valley. And we're embarking on an economic impact study. So every couple of years, the Navy likes to do a study of what value we're providing to the local community. And our study's a bit outdated. 2015 was the last time that was done. So that just kicked off a couple of weeks ago, and it's going to take us about 3 to 4 months to pull that all together. And that way, as we interact with the planning departments at the county level and at the city level, we can come with actual data that shows how valuable and how important the Navy is to the region, and that we can find areas of mutual use to work together on areas that affect us both. So we're looking forward to that. And I've kind of discussed environmental stewardship and range utilization. We're going to keep getting after all those areas in the future. Next slide. So that's what we've been doing out here at the base. And I just wanted to field any questions from either council or anybody online while I'm making my rounds through the different cities.
Okay. Are there any questions from the council members? Any questions?
Mayor, does it look like the 10K run is going to happen?
Yeah, we are going to do it, but it's going to be a virtual event this year. Just because of where we are with the current wave, we made a decision last week to do that one virtually. But I'm hoping, as the folks who are doing the planning for the Imperial County Fair, I'm hoping that the data supports the live event in March as we get further
What's that,
on
Thursday?
past the winter wave cycle.
Will you be running, sir?
No, I'd like that. I don't know. My knees are
I just wanted to say that I had the privilege this weekend of being out at the Imperial Valley Rifle and Pistol Association range. And on Saturday, the Blue Angels were doing a great job, and they provided a real impromptu demonstration for us out there. And we managed not to shoot any down with any of the Civil War cannon that we had firing out there. So it was a great weekend out there, and it was great seeing the Blue Angels practice out there.
Oh yeah, I had a chance to fly Saturday. It wasn't in an F-18, it was in something. It was in the T-45, but I went out that direction as well. There's a lot of pilots who don't know that range exists, and I have to kind of point that out to them and make sure that they're aware and everybody's doing everything safely and following the right procedures. But no, that's good stuff.
That they were fine, and we did see some additional aircraft out there, and maybe one of them was yours.
Yeah, it might have been.
Yeah. Thank you very much. If there's no other questions, thank you very much for your presentation. We look forward to meeting with you in the future. And I think we're having an event maybe, or a lunch or something out at your place and some orientation. So
The city manager's out to the base on the 27th to do an update on a little bit more on what the base is really looking at for the next 5 to 10 years, so that we can make sure that we're being good partners across the valley. So we look forward to hosting you, sir.
very nice. Thank you very much.
Okay, take care.
Thank you,
Bye-bye.
Captain.
Okay, so we can move to consent agenda. Items are approved in one motion. Council members or members of the public may request consent items be considered separately at a time determined by the mayor. I would entertain a motion for approval of the consent agenda.
This is George. I'll make the motion to approve.
Okay. Do I have a second?
Second.
Okay,
Donnie
from
Moore.
Donnie. Okay. I have a motion and a second. All those in favor? Aye.
Aye.
Those opposed? Okay, consent agenda passes. Okay. Okay, number 4 on our agenda is the city manager report.
Thank you, Mayor. I will defer to the next meeting and for the second time. Thank you.
Okay, thank you very much. Okay, number 5, regular business. 5A is update on the City of Brawley declaration of local emergency as a result of the COVID-19 pandemic and an overall outlook presented by Mike York, the fire chief. Mike?
Good evening, Mayor, members of the council and city staff, Mike York, Fire Chief. Just checking my audio.
You're good.
Sounds good.
You're good.
Thank you. A brief update for this evening. What we're seeing in our county and local area is a very large rise in our COVID numbers, as well as hospitalization ICU rates. Briefly, testing has been conducted at rapid paces. It's been reported throughout our communities that we're starting to have some difficulty testing people because of the availability of tests and long wait times at our clinics. However, we still encourage people that if they are symptomatic to pursue testing, maintain all precautions until they are tested and receive results back. Some of the points to bring up for this evening. We are no longer, when I began doing these reports in the past 2 years, one of the things we referenced was our tier metrics. We no longer abide by those rules in terms of what's open or what's closed, but those tier metrics are kind of long withstanding indicators of where we're at with our COVID response and our local situation. So our tier metrics for the last week, case count per 100,000 is 155.9. So very significant increase over our last report. We are seeing just our COVID numbers exploding, for lack of a better word. Our positivity rate for our testing is 31.6%. So almost 1 out of 3 people are testing positive that seek testing. Our local response, we've had 188 COVID positive calls within our city of Brawley, and another 380 calls that were likely COVID related. Our health order was initially our current health order was initially put in place December 15th. It was amended on January 7th, extending the universal indoor masking requirement until February 15th. It may be further extended by local or state order. We're pending further information and seeing where we go on that end. If there are any questions regarding any specific items or information for next report, I would take those now.
Chief, I was just curious what the number was for the infection rate from the last meeting. Curious for how much it jumped.
Certainly, I can give you that information if you will bear with me just 15 seconds, please. So on our last meeting, our tier metrics were 33.6 per 100,000 and a 13.6% positivity rate. Our current active cases as of today was 2,890. On our last council meeting at 12/21, our active case was 660. So about 2,200 more people with COVID in just shy of a month's time. You're welcome.
Any other questions? If not, thank you, Chief York.
You're very welcome.
Okay, so now we're looking at 5B, discussion and potential action to award professional engineering services agreement for Ashworth Leninger Group, ALG, to provide pretreatment program support services for resolution of changes associated with the Colorado River Basin Regional Water Quality Control Board approved pretreatment program administration, renewed permitting of the current 3 significant industrial users, and replacement of the current Bactel wastewater engineering team with a new industrial pretreatment consultant team for long-term support of the city's pretreatment program in an amount not to exceed $78,697, and authorize the city manager to execute the agreement presented by Guillermo Cias, Public Works Director. Guillermo?
Yes, good evening, Mayor, members of the council, public in general. As you read, Mr. Mayor, this item is to award a contract with the ALG company that will provide services for the treatment administration of the program that is regulated by the Regional Water Quality Control Board. And I will refer the further presentation to Steven Mireles, Senior Environmental Compliance Officer, to provide more details and also to answer any questions that you might have.
Okay, Stephen.
Good evening, Mayor, members of the council. Thank you for allowing me to speak here today. My name is Steven Mireles. I'm the Senior Environmental Compliance Officer for the City of Brawley. I wanted to provide just a brief slide to detail the way our current water is brought into the city and how we discharge. We bring water from the Colorado River. It's transported to us by the IID to our water treatment facility. Our water treatment facility treats the water, makes it drinkable, and then we use large pumps to pump it into our water distribution system. From there, we then distribute the water to our residential customers, our commercial customers, and our industrial customers. And so we then receive the wastewater from those 3 customers at our wastewater treatment facility where we treat the wastewater and then discharge it into the New River. And so in regards to our wastewater collection system and our wastewater treatment plant, the state of California regulates us under the NPDES permit program. And so we have certain limits to the constituents that we have within our wastewater and what we can discharge to the New River. Currently, the city of Brawley is required to maintain a wastewater pretreatment program, and that program's purpose is to regulate industrial wastewater discharges. So our residential customers, you know, we drink water, we take showers, we use water for our homes. There's nothing that we can really do. Similar to our commercial customers as well, but it's our industrial users that tend to, through their processes, introduce additional wastewater constituents into the wastewater stream, and we, with the pretreatment program, are required to prevent any pass-through or interference that may be coming from our industrial users. Currently, the city of Brawley has been using Bechtel Wastewater Engineering Services for the last 13 years. They've helped us navigate not only our relationship with the state regulatory authorities, but they also assist us with making sure that we are able to address our significant industrial user needs. So for instance, we have 3 significant industrial users within the city of Brawley. One World Beef Packers, which is a cattle slaughtering house. We have our hospital, Pioneers Memorial Healthcare District, and then we also have Gloriann Farms, which is a corn processor. These 3 industries are again, through the nature of their business, they create industrial wastes, and we regulate them through our pretreatment program. Bechtel Wastewater Engineering Services, again, have been with us for 13 years, and they are looking to retire. And so in the approval for their budget in July of 2021, we approved monies for them to assist us in locating a new consultant group. Over this past few months, the city has sought out wastewater consultants, and we found 6, requested for them to submit their applications and qualifications. Of the 6 consultants that we contacted, 3 of them responded. Ashworth Linenard Group, Larry Walker Associates, and Blackburn Environmental Services. The 3 applicants not only were deemed to be qualified, but we also looked at all of the applicants' references. So we interviewed 3 different references for each of the clients, and again, based off of the feedback that we received from their references, we decided to bring all 3 of the consultants into interviews. In those interviews, we were able to determine the applicants' qualifications, and also we were able to rank them. Ashworth Linenard Group, or ALG, was ranked number 1, and so we have moved forward with a request for a contract. So they are going to provide us, ALG is again going to provide us our pretreatment program, the ability to meet the requirements from the state, but also to be able to meet the needs of our industries. So again, our large industries are trying to add to our industrial base, trying to expand their operations or expand their treatment processes, and it sometimes requires expertise that our public works department may not have or may not be able to respond in a timely manner. And so ALG is going to be able to assist my department and the public works in general in being able to determine the needs and whether or not the requirements, whether or not our industries are going to be able to meet the requirements that the state has for our program. The city of Brawley is also currently working on our local limits update. We are trying to get that approved through the state. We've already approved it at the local level, but we're trying to get approved through the state, and we're hitting some additional, hoops that we need to jump through. And so while Bechtel wastewater engineers have completed the vast majority of that study. Some changes to our MPDS permit have come down the pike when they issued the new permit in June 15, 2021. And so those changes to our MPDS permit, Dave Bechtel is working on addressing some of those issues, but we also anticipate that the Regional Water Quality Control Board may require additional information and additional updates that was not a part of the contract that was originally for Dave Bechtel wastewater engineers. So ALG under this contract will also be assisting us in trying to get our local limits over the finish line as well. And so that's kind of just our general update on this. And we brought Christina Wong, who's going to be our main lead and speaking or be working with Public Works here for this program as well. She's here for any questions that you may have for her or for me.
Any questions from the city council members?
None from me.
Okay, no questions? Thank you very much.
Thank you.
Thank you. Okay.
We need a motion.
We'll need a motion to approve this agreement. So I'll entertain a motion.
This is George, I'll make a motion to approve.
I'll second it.
Thank you both. Okay, all those, any discussion on that? No? If not, all those in favor, say aye.
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 Those opposed? Okay, motion carries. You have your approval. Thank you.
I don't know if we would just want Christina to say.
If she would like to say
hi real
something,
quick.
sure, say hi real quick or whatever. Yeah.
Hi, can everybody hear me?
Yes.
Hi, Mr. Maris, members of the City Council, good evening. I'm here, Christine Wong, for Ashworth Langner Group, ALG, and we really look forward to working with the city and hitting the ground running.
Okay, very good. Thank you very much for being here, and no questions, so I'm sure we'll be talking with you later as you come in to give us your reports and different other items related to the wastewater treatment. Okay?
I'm happy to answer questions as they come up.
Thank you very much.
Mr. Mayor, this is Guillermo Pablo, Director. I just would like to remark that Bechtel Engineering and his subcontractor, Rich von Langen, have been very professional. That this procedure is not common, and Ms. Christine can also mention that to you, that usually a consultant is not very common to participate in the selection of the next one. And they have been very professional that help us to select the company, in this particular case, ALG, that will replace them, and they are making a very smooth transition. So we are very grateful that Dave Bechtel and Rich von Langen have been with us for so many years, and they are also helping us with this transition.
Thank you for that. Yes, we're very excited about that, and we're very happy that they did work with you so closely. I think they're retiring out, so it's not a competition, I don't think, at this point in time. And so I'm very happy that they were able to assist you in making this transition, and it sounds like it'll be a good one, and it sounds like we'll have good things to look forward to. Thank you. Okay, item 5C. Discussion and potential action to approve the purchase of a triple combination Type 1 fire engine for $665,191.04 with American Rescue Plan Act funds presented by Mike York, Fire Chief. Is Mike there? There he is. What's the 4 cents about?
They are exactly their numbers.
Okay.
Sorry. Good evening once again, honorable mayor, members of city council and staff, Mike York, Fire Chief. Tonight in front of you is the estimates and quote we received from Pierce Manufacturing regarding the purchase price for a new Type 1 fire engine. So for some clarification, a Type 1 fire engine is the typical fire engine, what you would associate with the fire department. Currently in our fleet, we have 4 Type 1 fire engines. One, however, is a 1995 engine that's been placed in reserve status for several years. And as a matter of fact, it's unoperable right now. It's awaiting some costly repairs that, quite frankly, aren't don't really have a cost-benefit ratio worthwhile doing. Right behind that, we have a 2003 pumper that's still in daily use. This past year, it required some significant funds to do some much-needed repairs, and it's still capable, but we need to place that in reserve. The National Fire Protection Agency recommends a 10-year frontline status for fire engines and a 20-year reserve status. So we have these two pieces of equipment that are both in that range. So we undertook the process of specifying an engine. Our last two fire apparatus purchases were through Pierce Manufacturing and through a project or a opportunity known as Sourcewell. We're able to use them as a single source without having to go for a RFP, RFQ. Pierce Manufacturing has been very good to us in terms of customizing our engines and making them exactly what we need. We have a design team within the city of Brawley, myself and three of my staff. We sat with our sales consultant. We went through the design, made sure that it's appropriate and it ticks off every box that we need for our city. And we came with the final purchase price of $665,191.04. And that is with and then there is a prepayment discount if we can pay the entire amount up front. This purchase is eligible to be used American Rescue Plan Act funds, and that is my presentation for this evening.
Okay, thank you very much. Any questions of Mike from the city council members? No? Okay.
I'll make a motion to approve this item, Mr. Mayor.
Okay, thank you, Ramon. Do I have a second?
I'll second it.
Okay. Any discussion related to this? I think certainly it's needed and it's a necessary item, and the public expects us to protect them from the way of fires or anything else that might occur. So with that, all those in favor?
Aye.
Aye. Those opposed? Motion carries. Okay, you have your approval, Chief York.
Thank you very much.
Okay.
Congratulations, Chief.
Okay, and we'll move to item 5D, discussion and potential action regarding mayoral appointments of city council members to boards, commissions, and committees for 2022. And I believe Alma provided us with a list of what we currently serve on. I have not had really a chance to talk to anyone about this. I'm assuming that most of you would want to remain in your current status with these boards, commissions, and committees. Does anyone need any changes? Does anyone desire any changes or anything else they would like to do?
I'm good with that as it stands, Mr. Mayor, as far as my assignments.
Okay. I think we all have our...
Mr. Mayor, I'm fine as well.
Okay. Mr. Wharton, are you okay with this?
Yeah, I'll echo those same.
Okay. And Mr. Hamby?
Yeah.
Okay.
Mayor, if I may, there is one commission or board, the Abandoned Vehicle Abatement JPA, where Mr. Gase, who's retired.
That's right.
If I could recommend moving Oscar Escalante up into the primary as the delegate, and I can serve as the alternate.
Okay.
If that pleases the council.
And another one I wanted to mention is the Association of California Cities Allied with Prisons, ACCAP. We haven't participated in that for, I think, since Councilmember Noriega left. So I don't know if we want to continue, because there's a membership that we have to pay if we want it. We haven't done it in the past maybe 4 or 5 years.
Are they active?
I'm sorry?
Are they an active
No,
group still?
It's still, but most of their meetings are like in Sacramento, and they're not local.
Gotcha.
It's not local, it's out of town.
Yeah.
Do we want to wait on that and check with that and see what their status is or what they want to, does Nava, I think, is the primary member and Castro is the secondary. I hate to not do that and then worry about it later if we needed to be there, but I'm not so sure that we do. But maybe we'll hold off on that one. We'll just hold off on that one. Let's look at that one. When do we have to pay the dues on that one?
The dues are due, I believe, every July.
Okay, let's wait and do a little research on that one, and then we'll see
Okay.
whether we want to change that or not, or just drop out of that one.
Okay.
Okay?
We may discuss that.
We're not sure. It hasn't, since I've been on board, we have not paid them, so.
Okay, well, maybe we're not on that committee to begin with, but let's do a little bit of research on that, Alma,
I'll
if you
check-
would,
I'll check
and we'll
tomorrow.
follow up on it. Other than that, I think everybody's good, and I think we stay the same, and I'll recommend, I don't know, do we need a vote on that?
No.
Okay. Okay, so then I'm just gonna keep everybody in their current assignments except for the one change, which is Escalante and Salcido. Okay?
And then I'll check on the other one first.
Thank you very much. Okay. Thank you very much, all of you. Okay. Okay, so now we go to 6 departmental reports. Library update by Desiderio Rodriguez, the library manager.
Yes, can you hear me?
Yes. Yes.
Good evening, council. Good evening, mayor. I'd like to just give you guys a up-to-date on what's going on with the library. First, I'd like to thank Councilmember Nava and Councilmember Hamby for showing up to our Christmas at the library. That was a successful event. Yeah, thank you so much. We had the public come out, and there was a lot of excitement for that. I appreciate it. We are looking forward to trying to put on a pet show. We're working out the dynamics for that. Our staff's still excited about that. They found some old ribbons when they were cleaning the back. And I guess once upon a time, the library used to put on a pet show, I believe. We'd also like to do a book with the blues, so maybe a read aloud with the police, get the community, get to know the police officers to the library. Some of the programs we're offering right now, we do have a reading tutorial every Wednesday from 4 to 5. These are for children's services. So every Wednesday from 4 to 5, we have reading tutorial. We also have homework tutoring on Fridays from 4 to 5. And we have weekly story time every Wednesday at 3:45 to 4, and arts and crafts every third Thursday at 3. For adults, we have talk time. This is a cool program for our English learners. It's they're in there with a tutor, and they can communicate, create dialogue amongst each other, and there's somebody there to correct them if they should make a mistake or need a grammar correction. So that's picking up momentum. We're getting more and more people signing up for that. We just had a resume workshop, and we did it with IDC. We did that virtually because it was last week and the numbers are going up. That was successful too. And we're working on establishing a computer help session for our adults who need computer literacy courses. Everything's digital now, and we're finding a lot of people calling and asking how to use some of our programs online. So we're just waiting for the computers that we ordered to come in, and we will begin that program as soon as possible. And that is what's going on with the library right now. Are there any questions?
Any questions from any of the council members? Thank you.
Mayor, if I may, I'd just like to take a moment to commend Mr. Rodriguez. He's been doing a lot over there since he stepped in as the library manager, and always coming up with him and his staff with new projects and new ideas, and making sure that we're out there with all our library services to the fullest extent. So thank you, Desi.
Sounds very much like that. I've been to the library, to some of the library board meetings since Desi's been there, and a lot of things getting done over there, and I think the ladies are happy with the progress and things that are happening over there. So thank you very much for that.
Thank you. Appreciate it.
Okay, moving right along to number 7, city council member reports. I'll let Ramon go first.
Thank you, Mr. Mayor. Yeah, first off, it feels like it's been years, right, like since Santa came around, but I'd like to acknowledge the staff for that. They actually drive right by my house, so that was pretty neat. My kids enjoy it. We usually, post up out there with our hot chocolate and chairs and wait for him. So, I also want to acknowledge the fact that we just celebrated MLK, Martin Luther King Jr.'s birthday, which is a very special occasion to, I think, all of us as Americans. Recently, I was awarded the Stone of Hope recognition from the Martin Luther King Jr. Commemorative Committee. I unfortunately won't be able to be there this January 29th. I'd like to invite everyone, if they could, to attend that. But obviously, it means a lot, and I'm very grateful for that recognition. According to them, it was handed out before the walk, so that means that we've been doing something good for a long time. So I appreciate that. I spent the last few days traveling these deep parts of Mexico visiting deported veterans. So I was gone for the better part of last week. I just got in last night, and it was just interesting to see, the conditions and the way people live in so many parts of the world, and an area that's, a 2.5 hour flight from us, to see how the difficult way of life that people have down there when it comes to crime, resources, and just the ability to move upwards. So, and every time I have an opportunity to see that, I'm ever more and more grateful to be a citizen of this country, and to have the opportunities that I have had here, to make something more of myself than what I could have been somewhere else. So it's humbling, I'll tell you that much. And so I appreciate the fact that these veterans that are down there in central Mexico opened their doors to me, and that they offered me whatever little they had for me to sleep in and to eat from their table. So I appreciate that. I'd also like to thank staff, and I appreciate all your hard work. I see what you guys are doing. There's a lot of stuff happening, and with this surge of COVID, I mean, I look around and everyone's had it, everyone has it. So we appreciate your hard work and the fact that you keep going. So with that, that ends my report. Mr. Mayor, thank you so much. And if I haven't told you yet, Happy New Year to everyone.
Thank you, Mr. Castro. Okay, Mr. Wharton.
Yes, Mr. Mayor, I'll be brief. Had the opportunity to attend, I think as most, that were able to make it to the Latigo Ranch ribbon cutting, and really the kickoff celebration of that entire development. That's well underway. So great comments were made. It was great to see everyone that we could out there, and obviously the article that came out, I think, in the paper. So just happy to see progress moving in all parts of the city. And outside of that, I think like most, I've been hunkered down with the COVID surge over the past few weeks. Seems like coming out of the holidays, it really kind of came on strong, as already shared by the chief. So outside of that, haven't had an opportunity, just as Councilmember Castro just mentioned, Happy New Year. Outside of staying healthy and safe, do look forward to the new year here. And that's all I have, Mr. Mayor.
Thank you very much. Mr. Hamby.
Thank you, Mr. Mayor. I don't have a lot to report. I also attended the ribbon cutting at Latigo Ranch, and also a ribbon cutting at the new location for the Christ Community Church Brawley campus. They took over the building that Victory Outreach used to inhabit right here on Main Street, and have done a really good job of updating it, restoring it, and they also are heavily involved in the community in all kinds of activities of outreach and community cleanups and that kind of stuff. So we appreciate the work that they do within the community of Brawley. We had a scheduled library board meeting that was canceled due to a lack of quorum, and we have one board seat that is vacated by Crystal Duran, who moved away to a new job. And so I'm sure those applications will be forthcoming, but if anyone has a desire to serve on the library board, that there's a seat available there. Also, we had to cancel a Parks and Rec Commission meeting because of we didn't have a lot on the schedule to talk about, but also with the surge in COVID, we just figured we'd wait and maybe catch it next month. So not much else to report. Happy to be serving the community of Brawley, and thankful for all the hard work that everyone puts in each department. Thankful for the leadership that we have in place right now in all of the strange times that we live in. And I'm glad to have Mayor Sam Couchman taking over for this year.
It's exciting.
Yes.
Exciting, yes. Thank you very much, Mr. Hamby. Mayor Pro Tem George Nava.
Thank you, Mr. Mayor. Hello, everyone. I just want to thank the public for tuning in and for their patience. I know that, typically we'd be meeting in council chambers, but, with the COVID surge, we're just trying to make sure that everybody remains safe. But I do want to thank staff as well for all the work that they're doing. I know it's been difficult the past couple of years, and just when we think we're getting into like a stride of moving forward, we have a little bit of a setback, but that's all it is. It's a setback, and we'll continue to move forward and have a great year. This is going to be a very, very good year for all of us. I'm excited about it, but it is a slower start. So let's just be patient, but let's keep on moving forward. I think we've been through some rough times in the past 2 years, and so this is nothing new. We need to be cautious and careful and continue to work hard and grind. So thank you all very much. It was great to be over at the Latigo Ranch. Ribbon cutting and groundbreaking, that was very good. Great project, and just excited to see that develop and happen. I know it's been some time in the making, and excited about that. Just good to see he was also featured in today's paper. So just want to congratulate not just Marty Coyne, but all the people that put that together, and certainly city staff. I know they took part in, and council too. We supported the project, and we should be proud of that. And so I'm proud of the fact that we took part in that project, and seeing it move forward is fantastic. Driving down there Friday, you can see really hundreds of people out there working, building, and developing. And so I'm hopeful that those homes will fill over the course of the next many months. I happen to be in the business of real estate and finance, and so today, unfortunately, we had several pricing adjustments. That means rates ticked up quite a bit over the course of the days, multiple times. Wow. And so hadn't seen that in quite some time. So that's just really kind of the start of higher rates, and I think that's going to continue. So that might impact things a little bit, but I'm optimistic, I'm hopeful, and I'm just excited about the future, and I just want the public and staff and everyone else to know that we live in a wonderful community. There's a lot of good things happening, not just in housing development, but business development, everything else. So, cool movement. I'm excited. Let's stay positive, and everyone be safe. Thank you all very much.
Thank you. Okay, for my report, I'd attended a major Rotary event at the Q. They had the world president of Rotary come down, and he was at the Q, and along with the local clubs, and also some of the San Diego club representation was there. They had like a 3-day event, I believe, over there. I attended the last day, the banquet, and the speeches by the president, and some of the other awards, and some pinning of awards on some of the newer members, and some of the older members were recognized. And it was a really great event over at the Q for Rotary. And Rotary does a lot of services here in Brawley for the city of Brawley, on the Rotary Park and other areas, education with scholarships, et cetera. And so I'm proud to be a member of that organization. I also attended the Latigo Ranch ribbon cutting. Very happy to see those houses being developed out there. That's been a project that languished quite a while here. And I would like to thank both Marty Coyne, the IID, and all the city staff and everyone else that's been involved in that, the construction companies and everybody. They've been really working very diligently out there to get that project completed, and I'm hopeful that that will continue with some of the other projects around town, and certainly was a great event. I also was involved, and I'm kind of a member and involved with the Civil War live fire that we do yearly here. This was our 22nd year. We did have the live fire this weekend, Saturday and Sunday, out at the Imperial Valley Rifle and Pistol Association range. We had a good group, about 50 people were there, 4 Civil War full-size cannon, a lot of infantry, some dismounted cavalrymen, and we actually fire Civil War weapons at targets, and it's a live fire, so it's not a reenactment. It's an actual usage of the actual weapons that they use in the Civil War. And we have a nice get-together. We have a little dinner out there. And it was a very nice event, and the weather cooperated greatly, and the Blue Angels provided the entertainment on Saturday. And so everything went very well out there. We all had a good time, and we look forward to that event every year. And with that, that is my report. Just thanking everybody for their service, and just stay safe. We know there's COVID surging, and I see a lot of people that tell me that they've had it. Many people are asymptomatic, but it does impact some people worse than others. Hopefully, everyone will stay safe and be good. We know we have a great community, so thank you very much. Okay, and moving right along, we'll move to city attorney report.
We'll just save that for a closed session.
Okay, and then city clerk report. Nothing to report. Okay, thank you very much. With that, we will go into closed session. And I thank everybody that was online in attendance. Thank all the members. I do appreciate the council members filling in spaces that I can't be at all the events. And I appreciate the church event that Councilmember Hamby attended. So as long as we support each other, we can make this work, and it'll be a great future for Brawley. Thank you very much.